Good morning, and thank you for coming. We are a full house, very exciting to see everybody. Conference actually filled in 9 days when we launched it, so we had a waiting list. So feel like you're at a Taylor Swift concert or something. You scored a great ticket. So anyways, we're here today to talk about bigger picture ergonomics. I'll get into why we moved this direction. But first, I'm going to give you a sneak peek of, no, I'm not. I'm going to tell you the announcements before we do anything else. So fire exits, the two end doors. If you go at the right one, you can go right outside. If you go at the left one, you have to go through the lobby. The washrooms are out your door to my left, your right, out there on the right-hand side. The Wi-Fi password and network are on the screen. There should be a little tag on your table as well. The only trick is when you go in, it wants you to put in your room and last name, and there's a little tab at the top. Just click for access code and then put in the code for the Wi-Fi. And if you want a mask, I know COVID's building again, there's masks at our registration desk, so feel free to take one. Okay, so now after that foreshadowing, I'm going to give you a sneak preview of something that's coming. We have did some user reviews of our current MSD prevention guideline website and had noticed a lot of early exits, let's call them. They landed on the webpage and it seems like people didn't know where to go. Most of the people in this room I know have used it and are expert users, but the people we're trying to reach are workers and small businesses and companies, and those people didn't seem to understand the website as it existed. So we've spent a lot of time rebuilding this. It will launch before the end of the year. We already have drafts. It'll go out for a beta review. Many of you will get an email asking you to look at it before it goes live to the public. But the big focus is trying to direct people into resources that are relevant for them. So I know this is a little hard to see, but across the top, there's a menu that says, I perform work, I supervise workers, so it's trying to get people to identify with their roles in health and safety in the province and elsewhere. And then the pane on the right is the example. If you clicked on I perform work, it goes through and it gives you resources that may be of benefit, explains what MSDs are, your rights and responsibilities, so things that are very relevant for a worker. So keep an eye out for that. I think it's going to be a big improvement on what's already there. Don't worry about any of the resources. All the resources are being transferred over, in fact, in a more usable form. They will all have a landing page with more explanation about the resources, and they will have the same links. So if any of you have resources, we are grandparenting, all of the resources so that if you click on an existing link, it'll go to the same place in the website. Okay, so back to our conference. First thing I want to recognize is our planning committee. So all these members, I think almost all of them are here today. And my own team at CRE-MSD, which is Catherine Brookman, Bettina Butler, Steve Fisher, who's our Associate Director of Research, Jacqueline Kurt, who's a new hire, just started with us in August, July, and Kim Mazzaros, who is off on leave. So we sat down and talked about this. Last year's conference, if you were here, was exoskeleton. So it was very mechanically focused on mechanical risk factors for MSDs. And what really drove some of the discussion was this article that appeared in CBC News last April. And it was that 1 in 5 Canadian workplaces have no legislated health and safety plan in place, which shocked me. I've talked to people working in the field and they weren't shocked at all, but still doesn't make it a good thing, right? And so at the time I thought, this is bad, but there's an opportunity here because health and safety plans and MSD prevention plans go hand in hand in my eyes. So we thought this was a very good opportunity that the ministry would respond to this and start looking at health and safety plans in place for businesses. So we created a resource that's on the website, and it shows how an MSD program fits into the health and safety plan that you have to have in place as a company. This is downloadable. I'll jump ahead quickly. Inside the program, that you have. You should have got one. If not, there's more on the desk out front. All of the resources are linkable from these QR codes, and those are PDF files that can be printed, shared, do whatever you want with them. There are hard copies just down past the registration desk as well. Please take them. Bettina would be happy not to pack them up and take them back to Waterloo. Okay, so this was the driving idea behind this conference, was trying to look bigger picture and get companies to realize this is not just about one worker or preventing one injury. Preventing all injuries is very important. I know I'm preaching to the choir here. Everybody in this room believes the same thing. But there's more happening, and there are fringe benefits financially, socially in a company, quality-wise we're going to hear about today as well. And the focus of this is really to try and give you evidence in the morning, what's existing in the literature and the research around this topic. And then we have two wonderful case studies in the afternoon where they're going to talk about how they implemented programs and the changes they saw inside their company. And I will say one of them is offering up their templates as well if you want to try and mimic their programs. So there's a lot on offer today. I'm going to try and talk the least possible because I think there's going to be a lot of discussion on this topic and with our speakers. So I will stop there, and I'm going to next introduce our first speaker, which is Dr. Joel Moody. This, sadly, is the first time I've got to meet Joel in person. We've met online many, many times, but he started in September of 2021, so he started right in COVID. So not an easy landing spot, I'm sure. So all of our meetings have been on Teams or Zoom, but Joel is the Chief Prevention Officer of Ontario. He has a vast experience and a fascinating background if you get a chance to talk to him. He was also the Chief Public Safety Officer and Senior Director of Analytics at the Electrical Safety Authority. Has worked for 17 years in various labor organizations throughout Ontario. He has an engineering undergrad, right? A doctor of medicine and a PhD too. Yeah, so we can call him Dr. Joel. So it's my great pleasure to have Joel come and welcome you.